So, what is your superpower?
My superpower is my confidence. Many experiences, bad, good experiences. See the smile on the patient's face.
What's your advice for aspiring medical students? Hey friends, welcome to the series of 73 questions with specialists where we deep dive and get to know some incredible medical professionals through a rapid fire round of questions. I am Naushad Khan, a medical student, and today we are diving into the world of cardiothoracic surgery. So let's get started with our amazing guest today. Hello, Dr. Lanje.
Hi Naushad, good afternoon.
Good afternoon. Welcome to the series of 73 questions with specialists.
Thank you.
Are you ready to get started with your
Yes.
73 questions?
Yes.
Okay, that's great. Let's get started. What's your name and specialty?
My name is Dr. Vivek Lanje. I am a cardiovascular and thoracic surgeon.
Wow. It's amazing to have you, sir. It's been a long time in the making and we finally have you.
Yeah, now we are at Lanje Super Specialty Clinic. You can see. It is our OPD complex where we assess our pre-op patients and post-op patients we manage here.
Thanks for inviting us. So,
Thank you.
starting with, we just had our first question. Now, moving to the second question, we'll be focusing on some educational and early career questions.
Okay.
Where did you go to medical school and in what year?
I passed my MBBS from Government Medical College. I admitted in 1989.
It's been a while. Where did you do your specialization from?
I did my specialization from BJ Medical and Sassoon General Hospital, Pune, from a Pune University in India.
That's great. Our last guest was also from BJ Medical College.
Yeah.
Next question. How many years have you been practicing for?
Almost 25 years in cardiac surgery.
When did you decide you wanted to be a cardiothoracic surgeon?
Mostly after the exam of 10th matriculation, then we have to decide what to do, whether opt for mathematics or biology. Then we selected biology subject.
And what specialization did you have in mind on your first day of medical school?
It was always a cardiac surgery.
Wow. I mean, I also have had that thing from the first day of med school, but I know this is a very, very competitive and very hard
Yeah.
specialty to be in. How about cardiovascular and thoracic surgery? When did you decide you wanted to be one? Well, I guess we answered that.
Yeah,
First
it was
day.
just an entry of the medical college
Wow.
only.
And next question, what other medical specialty would you have chosen?
I would have chosen plastic surgery, my second choice.
Wow, all about surgery. On that note, what is one specialty that is not for you?
I don't like ophthalm.
Oh, interesting. A very hands-on person then. Now, talking about your specialization, what inspired you to become a cardiovascular and thoracic surgeon?
As such, we're seeing the rising population in the incidence of the cardiovascular diseases in general population, and they are the neglected part of our India. So it make me that something to this should reach to the poor people. That was the motive.
That's a great motive there. What types of surgeries do you perform most frequently?
We perform the more frequently surgeries are the bypass surgeries, that is coronary artery bypass surgeries, and valve surgeries. And in pediatrics, we do the congenital heart diseases.
Wow, those are some amazing surgeries, you know.
Yeah.
Wow. What's the biggest myth about heart surgery you'd like to debunk?
Nowadays, it is said that in cardiac surgery it is very risky and the mortality is very high, and people used to get fear about the surgeries, being open heart surgeries, and they say go for the shortcuts. The cardiologist say they just put one or two stents and get out. But I say the bypass surgery is most rewarding surgery, and it has improved the quality of life, and the prognosis is very good, and people may 20 to 30 years lifespan extra.
That's what we have to change our mindset about. What's the stereotype of a cardiothoracic surgeon?
Say stereotype of cardiothoracic surgeon will always be a team leader. He will be like always work as a team, and he will be the leader want to have a leadership qualities in them.
That's right. Thank you for that answer. Do you think it's true for you?
Yeah,
Of
always,
course.
because I have working in many centers and developed many teams, and they are working at the mark.
Thank you, doctor. For what kind of person is cardiovascular and thoracic surgery the right specialty?
The surgeon should have a passion for his specialty, and he should have that stamina to work for long hours.
Passion is so important in medicine. I realize it like already being a med student.
Yeah.
So, next question. Who is cardiovascular and thoracic surgery not for?
The persons who have a easy life, they want OPD work, 9 to 5 work, and who have a peaceful life. For them, this branch is not a
That's a
branch.
hard trade-off, right?
Yeah.
Okay. How do you think AI and robotics will impact cardiovascular and thoracic surgery?
Yes, and robotics will improve the precision and the safety of the patients hereafter, and it will mostly the precision is the key.
I see we have two interesting rooms right here.
Yeah.
Could you tell us about them?
Now we are entering here. We get the ECG in this room, daily basis, OPD basis.
Yeah, for people who are not from medicine, it's those amazing up and down strips.
Yeah. Now we have here TMT room and some daycare. Patient can rest here for.
Okay, thank you for showing us around.
Now we are entering this is my chamber, OPD chamber where I consult the patients.
Wow. Okay, now we'll be looking on some daily routine and work environment questions. How many hours a week do you work?
How many hours? So almost it is more than 10 to 12 hours per day. And Saturday and Sunday also we are working. So can calculate it, maybe 70-80 hours more than that.
That's the most we have had till now. It's all the time. And can you describe a typical day in your life?
Yeah, let us start off. We start our surgeries around 8:30 to 9, then 2 surgeries or 3 surgeries depending on the emergencies. So it goes on till 6 or 7 o'clock.
Pretty long.
Yeah.
A lot of hours in there.
Then you have to see the OPD patients also.
In the evening.
Evening. So almost we go home at around 8 to 9 o'clock.
That's you're really sincere.
So
and
almost
hard
10 to
work.
12 hours busy schedule.
Yeah, it's one of the busiest, and it's been a long time to get this in the making.
Yeah.
Thank you so much for taking out your valuable time. How many patients do you see in a day?
As such, in OPD, on an average, 8 to 10 patients we see in OPD.
Okay.
And apart from that, 2 surgeries per day.
What time do you wake up?
I wake up at around 6:30.
6:30. Pretty early bird. You have to be, I guess, with your specialty. How many hours of sleep do you get on average?
On 7 to 8 hours.
7 to 8 hours. Wow, you still manage that.
Yeah.
Good. How do you stay healthy and manage the demands of your job?
In between, get time, then we have not on regular basis, but 45 minutes walk or 1 hour walk. And initially I was going to gym, but nowadays not getting time that
It's
after
hard.
COVID time.
I see. Yours is one of the busiest specialties out there. How do you stay calm under pressure?
Oh, that you have to keep your nerves and you should be always, what you say, should be calm in pressure. Whatever the pressure, you should have every A plan, B plan, and get out from the situation.
So you have plans in place to make
Before
sure
if A plan is not working, then you should have a backup. What should be the B plan to reduce the pressure?
Okay. And how do you handle emergencies in the operating room?
Emergency, it is a very interesting part and very challenging. You should be work accordingly. Seconds you have to think and act accordingly. So there is no waste of time, and you have to activate your whole team in seconds. So that is the key for the successful outcome in emergency.
I love it how you're portraying your specialty in the right way, that it's a lot about teamwork.
Yeah.
It's a very hard specialty, but it's so much about the teamwork of everyone working.
Yeah. Every member is important in this. Anesthesiologists, perfusionists, assistant surgeon, and nurses.
True.
Everyone is contributing.
Moving on to question 27. What's the most challenging aspect of being a cardiovascular and thoracic surgeon?
Most challenging means you have to maintain your stamina, your health, and the things should go as per your plan.
And how would you convince a medical student to choose your specialty?
First thing, they should have a passion for their work, and whether they want to go for the medicine or surgical branch, that they should decide once they gone through your MBBS or internship. In internship, most of the students get oriented to the medicine or surgical branches.
Okay, and what is the most rewarding part of your job?
Most rewarding, see the smile on the patient's face after surgery.
That's a huge relief. What are the biggest risks involved with cardiovascular surgery?
In cardiac surgery, mostly complications may occur during surgery. Some patient may get arrest, some may have a bleeding issues, so that can be tackled. Not a big issue, and we have all sophisticated equipments and all machines and all. So technology is so advanced, so that is not a problem.
And what's your approach to managing patient anxiety before surgery?
Patient anxiety, we educate the patient what the surgery is, what is going to happen, and how your life after that will be, and what is the risk factors. Everything we discuss with the patient and their relatives, and mostly the chest physiotherapy and all that we need in post-op. So we educate them so that it is not a new thing for them in post-op period. So the whole picture is narrated in front of the patients and their relatives, how the surgery will be done, what can be the complications, what can be the things outcome, how many hours after he will get wake up and be out of a ventilator, and on what day he will be going out of bed, and so on. So the patient is adapted to that situation. So the anxious level, don't think the patient is anxious after that. Once it is educated properly.
That's very good point. And what's the most important skill for a cardiovascular and cardiothoracic surgeon to have?
Skill that has to be acquired. Some may get inherent skills, God gifted, but it is a practice you have to get, and you have to show your results.
I'm learning so much from this. Thank you, doctor. Like having the passion for medicine, and then it's about putting in the work to go there, to reach there. Mostly putting work to get those skills.
Passion and patience. This is the only two things.
Thank you for those points. I hope our audience is taking note of those. And how do you collaborate with other medical specialists?
Yeah, it is a very good question. We have to, because it is a multi-organ, because whatever we do cardiac surgery, it reflects in the other organs also. So other specialties like kidney, brain, and liver. So we have to coordinate with the specialists also. Sometimes there may be derangement in the kidney function or liver function, brain function. So we have to, as a teamwork, we have to get involve all the specialties.
That's right. And how do you manage your work-life balance? I know this one would be hard for you, but how do you manage it?
Yeah, whenever we get time, then with family we spend leisure time, maybe at home or outside, or sometime outside the city.
But it's just so much devotion for your field, I see, right?
But that can be managed. That is not a big deal.
And can you describe the most memorable case that had a significant impact on you?
Yeah, recently 2-3 months back, one had a very severe trauma. One patient had, and he had multiple rib fractures. He was on ventilator. He's a young guy, IT guy. So he was about to get from ventilator, was very difficult. unless and until the ribs are fixed. And he was on ventilator, and everyone has given hope. No one was ready to operate him to fix the ribs and all that, because it is challenging surgery. We accepted that, and we fixed the ribs posteriorly, anteriorly, and for with God's grace, the patient was out of ventilator after 1 week, and he was discharged after 1 month of admission, and he is now walking with on. It was really challenging.
Okay, moving on to question 36. How do you think being a cardiovascular and thoracic surgeon has impacted your relationship with your family?
For considering my case, my wife is a perfusionist, so she is also belong to my specialty. So most of the time we are working together. So we don't find any difficult times. So we manage our time accordingly.
That's great, like a power couple working together. Wow. Okay. And how many steps should you walk in a day?
They say at least 10,000 steps a day.
Yeah, we ask this question to every guest, and we're just seeing how it goes. Okay. Who are you most thankful to from your hospital team?
To the whole team, I can't specify one person. My anesthetist, perfusionist, my sister, my assistant, and the whole OT team. And after that, also the ICU persons.
Teamwork.
It is a team.
Yeah. And what's the most innovative technology you have used in surgery?
Yeah, my innovation now is in transaxillary approach. I am not doing the keyhole surgery. I am doing all my SDs, mitral valve replacements, double valve replacement through the small incision in axilla. Wow. It is a small incision in the anterior axillary fold through which we are doing the cases.
So much better than opening the patient out, right?
There is no scar over the sternum, and scar is invisible.
That's a great approach, I guess.
Yeah.
Okay. Now, talking about what's your mindset, or what's your thought about having a private hospital or working in a multi-specialty hospital?
I would to love work in the institute where they all multi-specialty and other things are under one roof.
It's so much about teamwork again. I see
the
way. Okay. Now we have one question from our last guest, Dr. Prashant Kate, an orthopedic surgeon. Mm-hmm. What's changing in cardiothoracic surgery? This is his question for you.
In cardiothoracic, now we are moving more and more toward the minimal invasive, keyhole surgeries, robotics. So these are the newer things, and it is a now combined hybrid procedures we are doing. We do surgery plus hybrid, like the minimal invasive, we'll do the bypass surgery and 1 or 2 stents we can put like that. And one TAVR is the new thing is coming in, is already established now. That is the trans aortic, we put a aortic valve replacement. That is done to the femoral root. So that is a great innovative in the old age. We are the very morbid patients, more than 80 years. And where the surgery is a very risk, and they concerning to the pulmonary and other complications.
Now we'll have some questions on your personal life and your preferences. What's your favorite memory from your childhood?
Favorite memories, that's used to play the games like kite flying and going into villages. So used to visit villages in the summer vacations and roam around the village, fishing and all that. Wow. That is a memorable thing.
How well, it brought a smile on your face. Okay, now talking about your memories, what's your favorite memory of med school?
Memorable means we got their good friends which are still in our contact and we meet regularly. So that friendship is I think, memorable.
The takeaway from med school.
Yeah.
Okay. And what would you have done if not be a doctor?
Yeah, if I had not been a doctor, I don't think I would have done anything so special other than this field.
All the way in.
Yeah.
Okay. And how do you unwind after a long day of work?
After a long day of work, just finish my OPD and then go home, relax, get some one or any serials or any movies, and chat with my my daughter, parents, have a dinner together.
Wow, very, very family oriented and nice.
Yes.
We have a question coming up on one of those things soon. Next question: what's your go-to stress relief method?
Stress relief, just be alone, meditate, close your eyes for 10-15 minutes and get relaxed.
Meditation. Wow. And next question: being an cardiothoracic surgeon, you have great dexterity, right? So, are you also good with other hardware tools and a handy person?
Oh, sure. We also do our routine household work, sometimes plumbing, electricity, that you have to see.
Wow, so it carries on.
Yeah.
Wow. Okay. What's your favorite tool or piece of equipment to use?
My favorite will be my loops,
Loops.
through which I see the minute structures, minute coronary arteries, and do my stitching.
Okay, this would be an extra question in the 73. But so loops are the ones that you put on your goggles.
Through which we see the minute coronaries and do the minute stitching over
Okay.
the arteries.
Now I know the name for those. Next question. Do you ever get asked for medical advice from family and friends?
Yeah.
Yes. And carrying on to that, what's the weirdest question someone has asked you?
That what are the many things many times you see in the WhatsApp, the part of a joke, the wife will ask when his husband is going to operate, you have seen anything, any other his girlfriend or anything in his heart, like that.
Oh,
So
God.
weird questions.
That's interesting. Wow. What's a special talent you have? What's a special talent you have?
So extraordinary activities, nothing special. Just I enjoy music and all that, but
Okay.
can't sing at the park.
That's me too. I can sing in the bathroom, but no, not in a public
Yeah.
place. Okay. Next question. If you could go on a meal with anyone from history, who would it be?
And with my daughter.
That's so cute. Wow. Okay. And hypothetical, where would you take her for the meal?
Any good restaurant where
Okay.
the food is good and the ambience is good
Nice.
with good music.
It's about spending that quality time.
Quality.
Now, another hypothetical question. If you won $1 billion lottery, would you still be practicing medicine?
Yeah, I will be practicing medicine. It's my passion.
Passion.
I will utilize that money for the poor people to get all technologies to reach the poor people.
Wow. You just answered the next question, which was how would you spend it?
Yeah.
So that's a great answer. What's your favorite holiday destination?
Switzerland.
I think you were just there,
Yeah,
right?
yeah.
Wow.
It's heaven.
True. So, next question. You are a tea, coffee, or soda person?
I like coffee.
Coffee. Okay. And do you have kids?
Yeah, one daughter.
One daughter. Will she soon join us?
Yeah,
And then-
she is interested in medicine. She will soon be in medical school.
Wow. Welcome to the club.
Yeah.
Okay. Now, the next question is, what's your favorite movie or TV show related to your specialty?
To specialty, not but to the medical field, Grey's Anatomy is to watch, and one Sanjeevani, one is Hindi serial is there.
Okay. I'll have
That
to
has
check.
to- yeah.
I'll have to check that out. Thanks for the recommendation. Now, moving on to the next part of questions. What's the funniest case you remember during work without violating confidentiality?
Can't say.
No? Okay, we'll skip that. Next question. Every hero has a superpower. You are our superhero today. So, what is your superpower?
My superpower is my confidence only.
That's a nice answer.
My patience and my confidence.
That's your superpower. Okay. Of all the achievements, which one do you think has had the biggest impact on the world?
So getting my MCS degree, that was the biggest thing in my life. Because at one stage I was not able to know that I would have pursued this CVTS. In between I had some accident and all that, so I could not pursue my this. So I had to struggle for that to get through the entrance exam.
I see.
That is my very valuable degree for me. After great struggle, I achieved this.
Thank you for sharing that, doctor. What's your favorite inspirational quote or mantra?
They always say that passion and patience.
Passion and patience. I'll keep that noted. What's the best piece of advice you have received?
Best of advice is always commitment to the patient.
Commitment. I love the answers that we are getting today. It's so much about the values that you have to have in your life moving ahead. All those important things that you're talking about. So, what is the most rewarding part of your job? I think we had this.
Yeah, most rewarding is always the patient's satisfaction and a smile on the face when you get discharged from the hospital or when he is going out of your consultation room. He should be satisfied.
And can you suggest some books for our viewers that would have a great impact on their life?
Which medical books or general?
No, it could be any general books.
The books I used to read, that is a series from the Robin Cook. Robin Cook. There is a series of medical series books like Coma, Mutation, with this that. They're very nicely narrated
medical books.
It is a novel fiction like.
Oh, it's a fictional kind of book.
Yeah.
Interesting. I'll have to check that out. Never heard that before. Yeah. Okay. We only have a few questions left now. So, some thoughtful questions about a bit of reflection. Did you ever doubt if you could be a doctor?
No. I always to be a doctor.
And you reached it.
Yeah.
So, what gets you excited to work?
I get excited to work when we operate on some thrilling cases, some cases which are very rare cases, which are very rarely done. So it makes some thrill.
I see. You must be getting quite a lot of those in your specialty. I'm sure you have had your fair share of struggles in life. Can you share one of those struggles and what it taught you?
Yeah, I have many struggles since my MBBS. So to get MCH, it was a really struggle period for me. I had an accident after internship I joined. I was initially registered with my ENT surgery. So that time I had an accident, I had a fracture. That is both radius and ulnar fracture, which we call it the Monteja fracture. So I was in plaster and then almost I lost my 8 months. So I was registered for ENT surgery. I could not operate that time. So in frustration I had to leave this ENT subject because I was not getting general surgery. So just I gone to the ENT surgery and was preparing for the entrance to get general surgery. So I entered in the cardiac surgery. So I had to leave that ENT surgery after that. Then I did my job as a CMO in municipal corporation in Navi Mumbai. So one day I saw the advertisement of DNB. So I appeared for the primary exam and cleared that. And I could get my seat in the GMC Nagpur. So I did my 3-year general surgery course. And after that one day entrance exam was there for MCH. So I also cleared that.
Wow. That's such like a hard journey, right?
Yeah.
So much persistence.
So it was a switch over from one specialty to the different specialty.
I see, right? And it's again your passion that took you there, I guess.
No one could have maybe my family also or myself after joining ENT, how can be a cardiac surgeon. So that was a great turn in my life.
It was there, it was written for you.
Yeah.
Karma. Okay. So next question. How do you envision the future of cardiovascular and thoracic surgery?
The future of cardiovascular thoracic surgery is very great and it is a very rewarding branch. And now we are in minimal invasive robotics. So now it is day by day it is getting a painless surgery. So patient is mobilized next day and he can do his work within a week. So that old teaching was there, the patient has to take rest for 1 month, 2 months. So that is not a thing nowadays.
That's such an amazing change.
Yeah.
Good for the patients in a way. If you could go back in time, would you change any of the experiences that brought you here today?
Many experiences, bad, good experiences. Initial surgeries we see the things the patients, the outcomes were not good. So it was frustrating that time. So many students used to leave the branch, but nowadays the results are very good and we are seeing the patient walking the next day. So it is very gratifying. So it is again maintaining the interest in the subject.
I see.
Okay. What's your advice for aspiring medical students?
Aspiring medical students, they should have a passion for their work. There is no shortcut. You have to give your 100% and full commitment to the patient.
Right. And what's your advice for an aspiring cardiovascular and thoracic surgeon?
Say the same thing. He should have that passion, patience, and used to work for long hours, managing his family and the work culture, everything.
Okay. A question that is asked mostly to medical school applicants. Why did you choose medicine?
We choose medicine because it is directly with the population. You are connected to the people, and you are giving your good 100% things and try to cure the patient. You can't cure everything, but you try to cure the diseases which are maybe rare or common diseases, and you educate the people to get for the prevention and secondary prevention of the disease.
Okay. If you could give a life advice, what would it be?
Life advice, let's say, if health is wealth. If you are healthy, then only you can do your work.
True.
So spend some time for you.
Okay. Thank you for that, doctor. And would you recommend medicine as a profession?
Yeah, definitely.
Okay. And here we have the last question. If you had the power to change something about medicine and healthcare in general, what would you change?
Healthcare, it should be affordable to the every people. So mostly the poor people which are in the villages or in the remote areas, the every healthcare system should be reached to those people. And our government scheme, Ayushman scheme, has revolutionized this concept. And almost poor patients are getting free services and free surgeries also.
Wow.
So it is a great boon in India.
Yeah, I mean that's such important, like having the access to healthcare for everyone and affordability.
Yeah.
That's such a great answer. Okay, now that we're done with the questions, before we end, if you could ask one question to our next guest, what would it be?
I would like to see that whatever the specialty they are working, how they are giving these services to the poor man, and the things which are not reachable to the mass.
Their way of social work and community service.
Yeah, some community service and social work has to be there.
Okay, thank you for that question. So, thank you so much for taking out your time, Dr. Lanje. It means a lot. You are such an expert in the field, and it means a lot. I hope our audience learned a lot from this video. So, thank you for watching, everyone. Please comment below which was your favorite question from this video. and let us know if you have any questions for our future guests. So thanks for watching. Like the video, share it with anyone who it would help, and we would see you in the next one. Thank you so much, Dr. Lanje,
Thank
for
you, Naushad.
your
Thank
time.
you, Naushad.